Welcome to our program on dementia and Alzheimer's disease by Dr. Nair, St. Luke's Hospital Family Medicine Residency.
So my name is Dr. Nair. I'm one of the residents of St. Luke's, and you can call me Dr. Sue if that's easier. So we're going to be talking about dementia and Alzheimer's disease, which is a pretty relevant topic as we get older. It's really personal to me because I have the gene for Alzheimer's. So what I'm going to talk about is different kinds of dementia, what is dementia, how we can keep our mind sharp. And I want to commend you for even being here because you're working on this, right? You're engaging with me. So that's part of the process too. So we'll talk about that. If you have questions, you can interrupt me, but we can save it to the end as well. And then if you have personal questions, we'll wait a couple of minutes at the end. So you can ask us as well.
You say there's a gene that can be.
Yeah, so I will talk about the genetic portion of it. Okay. So dementia is a group of brain disorders like Alzheimer's. I'm sure you've heard of that one. That basically it affects how you function, it affects how we are as people, right? So it affects our personality, it affects how the things we do, so dressing ourselves, eating, how we talk to people, everything that we used to do when we were younger, it gets a little affected when we're older, right? So we want to talk about this topic. When you go to your doctor might do, the clock test or the slums exam. I'm not sure if any of you guys have done that before as part of your Medicare annual wellness exam. So it's a different way we screen for dementia, different kinds of dementia. Or we also talk about mild cognitive delay, which is like pre-dementia too. So your doctor should be helping screen for these things. Or if you're concerned, you should be talking to your doctor about these things. So we're going to talk about what those things are, what those symptoms are. So if you're concerned, you should be talking to your doctor. So there's risk factors like age. So as we get older, our risk of having different kinds of dementia goes up. There's a family history. So if you have a family history of, Alzheimer's dementia, Parkinson's, vascular diseases, so like diabetes, high blood pressure, stroke. If you were younger and you had repetitive head injuries, that would increase your risk of dementia as well. So if you have any of those risk factors, making sure you're talking to your doctor about screening you for dementia is important. If you have risk factors like high blood pressure, strokes, diabetes, making sure those are pretty controlled with medication is really important because that could increase the risk of dementia too. Can you hear me so far? Okay, good. We were talking about genetics. So there is a gene related to Alzheimer's called the ApoE4 gene. They don't routinely test for it. In fact, a lot of societies don't recommend testing for it. If you've ever heard of the 23andMe, the saliva test, that routinely tests for it. So when I got tested for that, I was just, interested in seeing what I had, and that was positive for me. Doesn't mean I'll end up having Alzheimer's or any dementia, but I have an increased risk of it. So it's really important for someone like me to make sure I'm exercising, keeping my mind sharp to, delay the progression of it if I do end up getting it. So even though there are genetics involved with Alzheimer's, we don't routinely screen for them because if you do have it, there's not really a lot of treatments for preventing it. There's a lot of treatments for hopefully delaying the progression of it. And we'll talk about that too. So what symptoms does dementia cause? Something I see as a doctor and what stands out to me is when my patient tells me they're getting lost driving. So somewhere like they're going to the grocery store they've gone to for the last 20 years and they ended up going a different route and getting lost somewhere else. That's, concerning to me. Word finding difficulty. So when you're talking to your family and your family saying, okay, what she's saying is just not right. It just doesn't make sense. And they bring it to your attention. I would like to hear from my patients when they're talking about that. So word finding difficulty is a big symptom I get concerned about. Memory loss of recent events. So short-term memory loss is important for a doctor to hear about. Trouble with communication. So with speech, with writing, that's really important. things that you were able to do on a daily basis, like going grocery shopping or paying bills or, balancing a checkbook. So, that kind of gets altered when you're getting older anyway, right? That it becomes a little more difficult. But if it's getting more difficult than it usually is, you should probably bring that to your doctor's attention or your family members, because your family member is part of the team, right? Changes in appetite or hygiene. So if you feel like you're not eating as much as you used to, or bathing as much as you used to, personality changes is a big one. So if you're having hallucinations, seeing things that no one else is really seeing, or hearing things that no one else is really seeing, that I want to hear about. And we'll talk about the kind of the type of dementia that will see those symptoms in. And we'll talk about a famous actor who actually has some of that. So I think it's more common than people think it is. And we'll laugh, some people will laugh about it when I say that, but it is something that patients will come to me complaining about. So it's something I would want to hear about. So on this paper I wrote, as dementia gets worse, people might have changes with their behavior or personality. So being a little more aggressive than they usually are, or picking fights with their family, or getting easily more frustrated, seeing things that aren't there, or believing things that aren't true. So those are kind of the hallucinations I was talking about. Being unable to eat, bathe, dress, or do other everyday tasks, or losing bowel and bladder control. Now, there are a lot of other medical conditions that kind of mimic a lot of these symptoms, right? So it's not necessarily always going to be dementia. It could be diabetes, or it can be depression, or B12 deficiency, or thyroid disease. But we always want to hear about, if there's a concerning symptom, we always want to hear about it, right? So talking to your doctor is a big key about this. So the different kinds of dementia, the most common one we hear of is Alzheimer's. So that's about 60 to 80% of dementia. So it's pretty prevalent, right? The genetic portion, the ApoE4 gene that I was talking about, is most correlated with Alzheimer's. So there is a genetic portion there. Basically, your brain cells are slowing over time, and if we were to do, we don't routinely do imaging for dementia, but if we were to do some imaging or looking which part of the brain is affected, there's parts of the brain that affect emotion, there's parts of the brain that affect vision or communication. So where you have more of the plaques associated with Alzheimer's or the dementia is what's going to be affected. There's also vascular dementia. So anything that affects the blood vessels in the brain with blood clots or damage by high blood pressure. That's why I talked about, if you have diabetes or high blood pressure, it's important you control that with your doctor, because we're going to try to prevent the progression of it. Parkinson's disease dementia. So a lot of my patients with Parkinson's have some form of memory loss or dementia. So a lot of patients with Parkinson's have some trembling, stiffness, slowness. As Parkinson's disease gets worse, some people develop dementia, not all, but some do. There's also Lewy body dementia. So Lewy body dementia is kind of like your Parkinson-like symptoms with some personality changes and hallucinations. So you guys have heard of Robin Williams. Robin Williams suffered from dementia and Lewy body dementia. So there are many, famous people that suffer from dementia, and you don't hear about it, but Robin Williams is a perfect example. And then we talked about the repetitive injuries with the falls and the head injuries. So that is a big one we talk about. So if you, played a lot of contact sports growing up, like football, or were in a lot of car accidents, that would be something I want to hear about, so you can originally screen you for this. Are there tests I should have? So your doctor or nurse will decide which tests you should have based on your individual situation. You don't routinely need a brain scan, but there are that, like some exams we do in the office. Part of your Medicare annual wellness exam, a lot of doctors, providers will do the clock test or the SLUMS exam. So we're kind of screening you for that dementia or pre-dementia, where we kind of be a little more concerned. Have you guys had that done yet? Yeah, no. So if you haven't, that's something you can bring up with your doctor. So treatment. There aren't any proven ways to prevent dementia. There's no cure yet for Alzheimer's, but there are a lot of medications that are coming out. Many of them are very expensive, and Tony will jump in at the end and talk about that a little more, but they kind of delay the progression of it. So it's kind of risk versus benefit. If you're very comfortable where you are in your life, you want to pay this much for a medication, or do you want to try to, have a better general health where you're exercising more, you're eating healthier, you're keeping your mind sharp by coming, to a senior center, doing puzzles, and we'll talk about different ways to keep your mind sharp too. But being in a class like this, you're engaging with me, so that's a great way to relate too, or keep your mind sharp at least. Caregivers for a person with dementia. So a lot of you have family, so your family could read this article too, or this piece of paper and try to look at the symptoms of dementia and try to keep a closer eye on you to make sure you're not having any symptoms, and if you are, have that conversation with your doctor. So this is really important to share with your family as well. There are some resources in the area. So the National Center on Caregiving or the Alzheimer's Association, there's one in Northwest Ohio here in the Wood County area. So there's some phone numbers here if you are concerned. And then at the end, I talk about 10 ways to love your brain. So breaking the sweat, so exercise classes or classes with your physical therapist, that's really important. Increasing blood flow to the brain and the body. There's an association between physical activity and reduced risk of decline for cognition. So basically, if you're exercising more, you're keeping your mind sharp. So that's really important. Hitting the books, making sure you're reading, keeping your mind engaged. If you're reading the paper, you're keeping your mind engaged. So kudos to you. If you do smoke, trying to quit smoking or reduce how much you're smoking, that's really important because, smoking is related to high blood pressure, stroke, diabetes, all of that. So making sure you're reducing your risk factors as much as possible. Kind of talked about this a couple of times, but controlling your high blood pressure, diabetes, taking care of your heart and your brain would follow. So that's important. If you have any family members who kind of ride motorcycles or bicycles without a helmet, or like contact sports like football, making sure they're wearing a helmet to prevent falls. Eating healthy, so fueling upright, so making sure you're eating your recommended amounts of vegetables and fruits. If you guys have heard of the Mediterranean or the DASH diet, if you haven't, talking to your doctor about that is important. Sleeping, if you can. Sometimes sleep disturbances or disorders that cause sleep problems can kind of mimic dementia-like symptoms. So if you're having trouble sleeping, talking to your doctor about that might be important. But if you're sleeping well, that's going to improve your memory and your thinking. So that's a really good thing to do. Taking care of your mental health. So if you're suffering from any depression, talking to your doctor will be really important because that could mimic a lot of dementia-like symptoms. We always want to make sure that you're taking care of your mental health and managing your stress. And then buddying up. So trying to stay interactive with a lot of people around you. So you guys are doing that right now. It's a good job. And then keeping your mind sharp. So doing something like a jigsaw puzzle or staying, doing some artwork, playing games. So I'm sure the senior center here offers a lot of opportunities for that.
My two big things is, we always want to try and find a cure. We always want to try and find a quick fix, because as Dr. Nair said, there's only certain medications out there that are they're not going to reverse the process. They're only going to slow down the process. And basically there's 3 stages of mental decline: mild, moderate, and severe. Some of those medications are used for the mild to moderate. Some are used for the moderate to severe. It just depends. There's lots of medications out there that are helping to try and combat or slow down the process for dementia and Alzheimer's. but these medications takes years and years of experiments and trials, typically 10 years long. And so the latest one that was out there was a medication called Aduhelm. And the problem with that medication is it's $50,000 a year. And is it worth spending $50,000 to try and slow things down? And we don't know how much that's going to slow down. Each person's different, so it could be a significant slow progression for some, for not much difference at all. It's a risk. What happened just 2 weeks ago is that medication that was released in the fall is now being pulled back by the FDA and the government because they're only going to use it for research trials. Why? As I mentioned, it's $50,000. And what was happening for older individuals that are on Medicare, it was driving up their Part B premiums. And we shouldn't have things like one medication be a reason why everybody else is having to pay significant costs. So they're pulling that back for research trials and trying to do a little bit more, but certainly there's other things in the work. And for people who are experiencing dementia or Alzheimer's, or people who are caring for those individuals, time is of the essence. So my other take-home message is just make sure that you're going to see your primary care physician at least once a year. They do Medicare annual wellness visits. We just did those yesterday. And it gives your physician a chance to look at baselines. And the other thing is, you know your body better than anyone else. If you start to think there's an inkling of problem or concern that you're just not having as much clarity, or you think things are low off, see your physician. It could be a quick fix. It could be something like a vitamin deficiency or a urinary tract infection. It could be something that's easily reversed, or this might be the beginning of something. So your physician, healthcare physician, is part of your team to make sure that you continue to age well and stay as independent for as long as possible. But again, just some basic information to help you out today moving forward. And like Dr. Nair said, there's also good resources both locally and nationally to help individuals, not only patients, but caregivers through the process. So we thank you for your time. Hopefully some of this was helpful, and I will get back.
Is there indications that could tell you that you're going from mild to moderate and to severe?
So there are tests we do in the office to kind of test your brain function and where you are to kind of, see how you're progressing. Are you staying the same? Are you going backwards? Like, are you improving? Or are you getting worse? So going to your doctor and having that baseline is really important because it'll kind of tell us where you are now and where you're headed.
A lot of that's not just the mental portion. It's how are you doing independently? That's also a big gauge for your physician. Are you still able to get yourself up in the morning? Are you able to bathe yourself, get yourself dressed, prepare your own meals? For some people, you're still doing your own checking. Are you able to still write out checks or balance your own checkbook, or do other things that some people take for granted on a daily basis? So those types of what we call activities of daily living are very important for the physician to know how much of that has changed in the last 6 or 12 months. That also helps them determine the progression of things, not just memory in and of itself.
That would be that 30 question test that the doctor gives you?
That is one of them. That's the mini mental status exam. They're shorter ones. You can always ask for the shorter version if you need to. So, but yeah, that's one of the things that helps them gauge things. And again, they'll compare that to the last time you did it.
We had went in Wilmington, North Carolina, UNCW, and the Mars group.
Yeah.
And they gave you the 2-hour test. And,
Oh boy.
it was, of course, it's quite expensive.
Sure.
Of course, they gave a detailed exam or report on it, but it was written, so I didn't understand much of what they wrote.
If you don't, you can always bring that to your doctor and they can explain it to you. A lot of patients, they go through a lot of testing that I don't do, and a lot of my job is to kind of clear the confusion too, and try to make sure they understand what's going on in their health.
There's a lot of things we think about and that we fear as we get older, and certainly this is one of those things. So trying to do what you can individually to stay ahead of it and stay in contact with your physician, and particularly for men, because we're stubborn, we don't like to talk about things that are happening with us because we don't want to have to go to the doctor and get exposed to tests and have everything snowball. But it's going to help your loved ones as well to know what's happening so that everybody involved in your life can better support whatever might be occurring in the neighborhood. Thank you for your time.
The plaques.
So there are some proteins for Alzheimer's, like a tau protein, I'm not sure if you've heard of that kind of builds up in your brain. So let's say you have the gene for Alzheimer's, it's more likely those proteins will kind of build up and kind of stick together and cause these little areas in your brain. Where those are in your brain will affect what you're doing. So if it's in the area of the brain that affects communication, that'll affect how you're going to talk to people. It affects the area of the brain where, your personality is in the brain. That'll affect, how your personality is, if you're going to get more frustrated. Does that make a little more sense? Yeah.
Thank you. Appreciate your time. Enjoy the weather.
Somebody
Hopefully
is
we see you
online,
last
so I'll
week.
just see if they have any questions.
Sounds good.
So I know, Sue, you're online. Did you have any questions? You may not.
Okay.
All right, we'll go ahead and stop our recording. Thank you to Dr. Nair for joining us today.
Sure.
You see on TV these advertisements for like Prevagen, these kinds of things. What do you think of this? Over the counter, supplements that you can take?
So there are a lot of supplements out there, but the supplements may interact with your other medications. So a lot of what we do in the veterinary wellness exam, we look at your medication. So I just had one gentleman yesterday who was taking a supplement to kind of improve his memory and his sleep, but that increased his fall risk. So we kind of talked about risk versus benefits, and I took him off some of them. So, and it's important if you are taking supplements, bring that to your doctor's management. Sometimes doctors don't know a lot of supplements out there because there's more and more supplements coming out. So it's important for you to bring them in so we can do the research to kind of look at your medications, your other medical history, and talk about risk versus benefits.
My only other input regarding that is some of that is FDA approved and some of it is not. A lot of times when you go to one of the local natural stores in town, like Bassett's, or I don't want to just single them out, but there's other ones. There's a lot of those types of medications that might be endorsed by certain groups, but are not necessarily FDA approved. And like Dr. Nair said, you really need to take a look at how that might potentially interact with something else that
I have a
good
question.
question. Yes.
It's my husband and his dementia, and I know there's a huge difference if he can socialize, but he tends to not socialize when you get in a group. He just sort of plans up, but if he does, it's like a difference. It's so good. Do you have any suggestions on?
So are there times where he socializes more than the other? Or there activities
Well,
he likes?
Old friends,
Yeah.
he really perks up, but they're not around,
So, as I say, we have the Guiding Pathways program.
Yeah, is that a lot of interaction?
That's a lot of interaction. It's like their own community of support. And they it's a lot of gentlemen. Yes, it's a lot of
Okay.
gentlemen, and it's a great way for them to do interactive activities and things, and just the camaraderie of it
Yeah,
is uplifting in itself. So just being around someone that understands where you're at and, just supporting you, when you leave at the end of the day, the mood elevation is like incredible. And it sustains
Really?
itself for the day. Yeah,
and that's once a month,
so we have 3 times a month. It's
great.
2 times in BG and then 1
Wow.
time in Perrysburg.
Do the same people go?
They tend to be a group, and we
Yeah.
limit it to a maximum of 10. So,
And to me, that's really good to hear, because my last take home message is no one should have to go through something like this alone. It's not unique to you. I mean, you personally might feel that way, but there are a lot of other people, both as patients who are experiencing issues of dementia and Alzheimer, but the caregivers. So to hear something like that type of programming being available, and kudos to you for speaking up and sharing that personal story, because now you have a potential resource to help your husband and to help you feel better in the process.
I had known about it, but I didn't know
most
it
people
was,
apprehensive,
yeah.
and it's one of those things where they're like, I don't know if he'll like it. And,
Yeah,
when he leaves, I can guarantee you, most of the 90% of the people are like, this was so fun, I'm coming back. Just because they feel supported and they're engaged. We have coffee when we get together to start off. So we talk and we have general conversation, and then we go into some activities.
Yeah. You also had the Parkinson's related disease
Mm-hmm.
exercise. Things that
Yeah.
I'm gonna try to get ready
Yep.
to go to.
Those
Yep.
are the things that make me feel so good about facilities. such as
Mhm.
this and what they have to offer. So, thank you.
All right.
Thanks, everybody. Yes, ma'am.